Now, the last condition of the degenerative disorders of conjunctiva is xerophthalmia. What is xerophthalmia? Xerophthalmia, it is the ocular manifestations of vitamin A deficiency. Ocular manifestation means there will be different pathologies in the eye, and these different pathologies and conditions these are the manifestations of vitamin A deficiency. So these all manifestations are called xerophthalmia. Okay, we know that vitamin A deficiency can be caused by malnutrition. When there is malnutrition, it can cause vitamin A deficiency. Malabsorption can also cause vitamin A deficiency. For example, IBS, IBD, chronic diarrhea, these conditions of GAT can cause the malabsorption, and results it will cause vitamin A deficiency. Okay. Now the sources, we have the animal sources like the meat, liver, egg yolk, etc. And we have the plant sources like the beta carotene. Okay. So what are the functions of vitamin A? Why the vitamin A causes different pathologies in the eye? First of all, vitamin A is necessary for the normal growth and maintenance of the cells. Vitamin A is necessary for the protection of cells from the immune system, from free radicals, etc., from inflammatory processes. And we know that vitamin A is it is the precursor for pigment, for the visual pigment, photoreceptor visual pigment. Okay, so these are some of the functions of vitamin A. Now you will get the point here why the vitamin A deficiency causes ocular manifestation. The clinical features are conjunctival xerosis. Conjunctival xerosis is the dryness of the conjunctiva. The conjunctiva will become wrinkled like this. Okay, there will be the wrinkling formation in the conjunctiva. This is called conjunctival xerosis. Xerosis means dryness. So why there is the dryness? So when there is no vitamin A, we know that it is necessary for the normal growth and maintenance of the cells. What will happen? Remember, before moving forward, you should know one thing. That on this region of the bulbar conjunctiva near to the cornea. The bulbar conjunctiva near to the cornea and the pepral conjunctiva. Okay, the conjunctiva under the lid margin. It has the conjunctiva under the lid margin. Okay, these conjunctivae, these are actually containing the non-keratinized squamous epithelium. But in the fornical conjunctiva and the bulbar conjunctiva away from this cornea. So the fornical conjunctiva and the bulbar conjunctiva away from the cornea, okay, from this limbic region, it has columnar epithelium. And we know that the functions of the squamous epithelium is to protection, okay, and the columnar epithelium is mostly secretions, okay. So what will happen that when there is a vitamin A deficiency, this columnar epithelium it is more vulnerable to damage, okay. So this columnar epithelium of the fornical conjunctiva and the bulbar conjunctiva away from the cornea, it will be damaged and it will be replaced by keratinized squamous epithelium. So now this part of the cornea of the conjunctiva which has columnar epithelium, but because of the vitamin A deficiency, the epithelium is now replaced by the squamous keratinized epithelium. So there will be no secretions in this area. There is the epithelium is now the epithelium of the skin, because this is also the keratinized epithelium, and now this columnar epithelium is also replaced by the squamous epithelium, keratinized squamous epithelium. So there will be the dryness. So this is why conjunctival xerosis is actually caused by the squamous metaplasia of the columnar epithelium because of the vitamin A deficiency. Now the next feature is Biotard spots. So what are Biotard spots? Biotard spots are actually a small elevations, a small whitish elevation over the bulbar conjunctiva. These small whitish and patchy elevations, these are actually caused by when there is some kind of damage because of the xerosis, conjunctival xerosis, there will be some damage, so the area will be infiltrated by the inflammatory cells. Okay, So now the debris, the inflammatory cells, when this mass is now will be attacked by bacteria, Corynebacterium xerosis, and this Corynebacterium xerosis will cause the whitish patchy elevation. We will also have corneal xerosis, like conjunctival xerosis. When there is a wrinkling of conjunctiva, we will also have corneal xerosis. Okay. We will also have, due to the corneal xerosis, we will also get corneal ulceration. Okay. So corneal xerosis, corneal ulceration. Now these will be the visible features over the cornea. Okay. Now we will also have some problems with the retina, because vitamin A is necessary for the formation of visual pigment. So there will be problem with the retina. For example, when we look through the peripheral retina, it will appear pale. So the peripheral retina will appear pale, and there will be, when we do electroretinogram of the cornea, then ERG amplitude will be reduced. Okay, when we do electroretinogram, its amplitude will be reduced because there is no visual pigment, so electrical activity will be destroyed and ERG amplitude will be reduced. Okay, so these are the clinical feature and manifestation of the vitamin A deficiency, which is called, these all manifestation and pathologies, these are called xerophthalmia. Now the World Health Organization has graded these clinical features into some grades. Okay, we have the XN grade. XN grade means there will be night blindness. So the patient will present with night blindness. It means it is an XN grade. Okay, when there is X1A grade, and with X1A grade we will have conjunctival xerosis. Okay, with conjunctival xerosis, conjunctival xerosis is X1A grade. X1B grade is the bitard spots. So when there is small patchy elevation over the bulbar conjunctiva, it is called X1B grade, bitard spots. Okay. Now we will have X2. In X2 grade, we will have only corneal xerosis. Okay, there will be the dryness of cornea. So in X2 grade, corneal xerosis. X3A grade is the corneal ulceration. So when xerosis will be followed by ulceration. Okay, so X3A grade is actually corneal ulceration, but it is less than one third of cornea. Okay, when the corneal ulceration is less than one third of the cornea, it will be called X3A grade. And X3B grade, when this corneal ulceration is more than one third of the cornea, it is X3B grade. And then we have the last two grades, which are XS grade. There will be the corneal scarring. So when the cornea there is the scarring, it will be XS grade. XS grade. The last grade of the World Health Organization is XF grade. There will be xerophthalmic fundus. The retina, when we look through the retina, the fundus will be xerophthalmic, mean it will be pale. So the paleness of the fundus is called xerophthalmic fundus. And this is the last stage of the vitamin A deficiency, which is called XF stage. Now the treatment. How can we treat the xerophthalmia? Xerophthalmia can be treated by first of all, we will give the patient, as the condition has produced dryness because of the squamous metaplasia of the columnar epithelium, so we will give artificial tears. We will give retinoic acid. Retinoic acid is actually vitamin A. So in the form of topical therapy, we will give retinoic acid to help the cells grow and to protect these cells from the damaging effects of inflammatory infiltrate. Okay. Next, we will treat the ulcer of the cornea. As if there is the ulcer is present, we will treat the ulcer. Now, if the case is severe, if the xerophthalmia is severe, we will do systemic therapy. And systemic therapy, we will prescribe the patient oral vitamin A. And if the case is so much severe, then we can also get intramuscular injection of vitamin A. Okay. So these were some of the degenerative disorders of conjunctiva. I also have prepared notes. I will get the link in the description. You can also go through the notes and can get some knowledge. Okay. Thanks for watching the video.